Welcome to a special edition of Ask Arlington. I'm Jay Warren. On this episode, we're bringing together the Arlington Fire Department and our City Public Health Authority to make sure you have the latest information on the city's response to coronavirus. And thanks in large part to you at home, we're seeing some positive updates. What trends have we seen in COVID-19 cases in Arlington?
For the last couple of weeks, we've seen, of course, an increase in the number of positives, which is to be expected because we're increasing testing as well. But what we have also seen is that the number of cases in residential facilities, including nursing home and long-term care facilities, that number has increased as well. But the overall numbers of hospitalizations has actually gone down in the last 2 weeks.
We hear a lot about total case numbers, but are there more important things to monitor?
The entire COVID-19 response effort is really designed to protect the hospital system from an uncontrollable surge of patients that could overwhelm the system. We know that, so therefore for the last 3 weeks we've been watching the hospitals, been watching the bed counts, the number of ventilators, and the number of COVID patients. And the good news is, in Arlington, the patient count has been stable. In fact, it's trending down. And it's trending down for a number of reasons, but I think the important reasons are first, the first responders in the field, the healthcare workers, and you, the Arlington citizens, who have complied with social distancing standards issued by our city leaders, and it's made a real difference. And we're very excited to report that we are stable here in Arlington, and hopefully this will set us up for future decision making that will help our community.
Does all that information mean social distancing is working?
Yes, social distancing is working, and we've seen that in our numbers. We have not had a huge surge of people that have been hospitalized, so thank you to everyone for doing the social distancing that you've done. And as we move through this, we're taking a really hard look at whether we continue to need social distancing and at what levels. Certainly when you go out, we do recommend that you wear some sort of protective, either a simple face mask or even a homemade mask. That will help reduce the incidence of spreading, particularly people that are asymptomatic or minimally symptomatic, people that may not even know they have COVID virus. We are taking a hard look at that, and we will continue to do so as we move forward through this to see if we can loosen the restrictions on social distancing.
How do we transition back to normal life?
As the hospital COVID patient counts go down, we'll start relaxing the social distancing standards. We'll do that in cooperation with our business partners and other community leaders to get to the right place on this one. There'll be some transitional decision making, but we'll be returning to a state of normalcy sooner than later.
Thank you at home for doing everything you can to keep Arlington safe and healthy. For daily updates and much more, please visit arlingtontx.gov/coronavirus.